Welcome back, welcome back. This is still the Health Hub Show, and I am grateful that you have not tuned out. So, again, do you plan to invest on a building? Or are you planning to make a magnificent home? Dreamworks Investment Limited, they are your people and they are the partner you need. So, as we proceed, we were talking about the mouth to mouth. Inakwanga ya kufungua hewa ama inakwanga ya kufanya nini?
Mouth-to-mouth resuscitation is just to ensure that there is adequate ventilation to this person. But in most cases, it's not advised to give mouth-to-mouth resuscitation nowadays because ugonjwa zimekuwa nyingi.
Kila mahali.
Yeah. So you may end up giving mouth-to-mouth resuscitation, you end up being a patient yourself.
Oh, yeah. So, when it comes, okay, umesema we are not supposed to. So, what tools are used to ensure like the breathway?
Okay, in my field, we use something like a balloon. I don't know if you are familiar with it. Kama mangalia kwa movie, there is something like a balloon people.
White one.
Yeah.
Clear one.
Yeah. So that's balloon is what it's called a bag valve mask.
Mm-hmm.
So that bag valve mask, we connect it to an oxygen cylinder. Then we place it on the patient mouth and nose, and we give this person breath for after every 6 seconds.
Okay, can you walk us through one of the procedures that you've done before?
Procedures.
Like after your arrival, what do you start with next?
Okay, what you start with, you start with airway. We check if the airway is open and patent.
Mm-hmm.
If the airway is not patent, there is an airway agent that we use to keep the airway open. Then we go to breathing. We check if there is a rise and fall of the chest.
Okay.
So if this person has a breathing difficulty or in short, this person is unresponsive, we connect this person with to our oxygen cylinder. Then we check for circulation, and then in circulation we check if there is an obvious bleeding. So if there is any major bleeding, we control it.
Okay. Maybe the personnel ama the medical personnel haijafika to where that scene is and where that victim and the person is. How do you ensure, let's say they are responsive. How do you ensure you keep them responsive until the medics are there?
Okay, for one, you just talk to them. Mm-hmm. When you talk to this person, you are ensuring that the airway is open. Mm-hmm. Yeah, because hakuna mtu anaweza ongea if the airway is blocked.
Okay.
If in other cases, if this person is unresponsive, there is a maneuver called the head tilt chin lift. Yeah. Okay. This is a maneuver where we just tilt the head upwards, just to ensure that there is adequate and sufficient air passing through. Okay. So that this is just a basic first aid training. For instance, somebody has undergone a trauma injury, we use a maneuver called the jaw thrust maneuver, where we put force on these jaws. We push them forward. Okay. If you push them forward, the airway is going to be open.
That is ina sound ni kama ni ya medical personnel strictly. Najaribu kuangalia if at all a situation occurs na hakuna anyone who has that medical ability ama that knowledge, what is the easiest way? Ama what is the easiest procedure?
The easiest procedure to maintaining an open airway is just maybe you just talk to them. If this person is responsive, you just talk to them. It makes sure that the airway is very open.
Okay. Now, getting back to after you've picked the patients, already they are patients jumshapika, what protocol do you use to ensure they stay responsive until you fike kwa hospital?
Okay, there is no protocol regarding to our patient. What we say is just we treat and fix the patient. Protocol comes in when we are trying to administer certain medication, where we should first call our medical director to give us a go-ahead to administer.
Oh, now how do you monitor the patient's signs in an unresponsive patient? Mseme uko naye kwa gari. You use the direct machines.
Yeah, can use the direct machine, the monitors.
The monitors.
Yeah.
And if it's locally, whatever you said, kuekelea.
Here it's manual.
Manual. So, yeah. No, I'm trying to become a medic.
Yeah, we can we can survive without those monitors. Yeah, we can just use manual and we'll be okay.
Wow. Now, you talked about the 4 questions that you use. Are they the common strategies to use while communicating to someone? Don't keep responsive.
No, we actually use mnemonic called sample history.
Okay.
So in this sample history, we ask this person for if he or she has any sign and symptoms, if he or she is allergic to any medication, if he or she is undergoing medication, and what was the last oral intake, and the events leading to that event.
Well, anyway, that's just for medics. So if any personnel ana need training, ni procedure gani anaweza chukua ndo akufikie?
Okay, one can start with basic first aid, occupational first aid training. Then for some people, if they're interested in medical field, they can start with a course that is called an advanced emergency medical technician, as well as a paramedicine.
So if I need a train, naonanga unaendanga kutrain. I have seen you before, nimeona mahali ukitrain watoto, nini. So if I needed someone to train maybe my crew ama a school, what's the procedure to get up?
Yeah, just go to any branch of Red Cross, you say you're in need of training, and they come to assist.
They come to assist you. So wewe ndo utaalokitiwa uende ukatrain. Okay, now how do you stay updated on the latest guidelines?
Okay, there is 2 guidelines that we use. One is GFAFA guidelines that is updated after every 5 years. Another one is an organization called the American Heart Association. That's where we get our guidelines.
Well, before we proceed again, I want you to subscribe on a very amazing song inaitwa Ndaviti by Faith Zilani. All you need is to take your phone and press *860*812# and enjoy the song. What are the possible risks if I don't take keen interest ama keen attention to someone who's unresponsive?
They may actually go in a state of cardiac arrest and they die.
So they die? They
die. And in most cases, if they're not taken care of, they may end up having brain damage. Let's just say a person is unresponsive for more than 4 minutes. This person is likely to have a possible brain damage due to the brain lacking oxygen.
Okay, so basically now I think I understand this. Unresponsiveness is caused by lack of movement of oxygen in the body.
Yeah.
Well, that is the information we needed today. I hope you have learned and you have enjoyed the session. Kindly, unaweza, maybe if someone needs information about in medical attention or anything, can they get to you directly?
They can call an emergency number which is free. That was 1199, or they can call 0700-395-395. Those numbers, they will direct you to medical dispatcher and they will be able to assist you.
Okay, kindly remind them your name again in case they missed.
I go by the name Omar Yusuf.
Thank you very much. So I hope you have enjoyed the show. I hope you have learned a lot and how to handle an unresponsive person. So again, kabla nitoke nitawakumbusha tena. Don't miss out on these amazing, beautiful architectural designs. Don't miss out on the interior decorations because DreamWorks Investment Limited Company, they are here for you and to ensure they turn your dream into a reality. Oboro TV Business, I am Nyambura Kamau and this is the Health Hub Show.